this is Dr. DelValle, and I'm a family physician in train, but I've been doing aesthetics for about, I want to say about a year and a half, maybe close to 2 years. I started doing Botox and demo fillers, which I want to say that I took them, in a different program, not with Empire. But after that is that I became involved with Empire training, and like I said, I've been doing it for about 2 years. Well, I decided to do the membership because I actually, I look at the entire curriculum that you guys have, all the sessions and all the trainings that you guys had to offer, and they're all outstanding. They're all stuff that I want to bring into my practice, and price-wise, you can't beat it. I'm telling you, because remember I told you I did a Botox and dermal fillers with another company. I pay $1,500 just for one course of each, right? So that was almost half of what I paid for the entire course, which now I have a full 2 years to take as many courses as I want, even double up or go up 3 times if I needed to. So far through Empire, I've taken mesotherapy, I'm taking sclerotherapy, I've taken anti-aging, I've taken medical, weight management, and reviewing dermal fillers now. And tomorrow I have the PRP class with you guys as well, and then a few other ones that I plan to take later on. But regarding the instructions, instructors are great. They're very friendly, very knowledgeable, and they're in the subject that they're teaching. And the beauty is that you become to get to know them even on the short time that we're here, because you see them one time and then you see them again in the next lecture. You get to actually get kind of close to them, to the point that if something comes up in your practice and you really don't know the answer, you can always email them and they'll respond to you right, actually pretty fast. They respond back. So courses wise, they're great. Instructors, they're awesome.
Okay, and the hands-on that you have to do?
Oh yes, hands-on. So usually our course goes lecture, learn about the product, learn about what to do, what not to do, how to stay away from getting in trouble, and then in the afternoons, evenings of the course, we actually get a lot of hands-on. We get to practice a lot with the actual products that we're going to be using later in practice. If it's, for example, with the fillers, we get the fillers, we get people to either members or people that come in, so we can practice on them, injecting the product. If it's with, for example, the mesotherapy, same deal. We get people to volunteer so we can inject their veins. For the mesotherapy, I actually was a volunteer to try to get rid of my, love handles and stuff like that. So, it's great. It's kind of like, it's almost like a one-to-one, because the instructor is there, checking on everybody, and more than anything, you get to really practice on, live people. They'll tell you, hey, this hurts, this doesn't hurt. Well, no, it was no problem. So it's great. Yeah, it's awesome. With the sclerotherapy, I never done it before, I never taken it. I'd seen people done it. I came to the class, got to practice on, like 2, 3, or 4 people. Immediately, as soon as I went back, I ordered the product, and I actually practiced on a couple of people in my office, and then now I'm actually doing it to patients. I'm already implementing, as I'm learning, I'm actually implementing in the office. Like I said, I started with Botox and the fillers, but now, I'm doing sclerotherapy. I'm actually going to start doing the mesotherapy. Obviously, I'm doing the laser as well, which is another course that I took with you guys. And as I'm learning, I'm implementing them in the office as soon as possible. Once you sign up for the membership, right, you can add up to 3 people from your office staff that that are sort of licensed, that can actually do some of these some of the procedures. Exactly, either to explain to the patients or, helping the office to do the procedures themselves. So, and, with a very low fraction of the price, really.